Hi everyone, Dr. Jenny Brown at Northeastern Reproductive Medicine in Vermont. It's a beautiful day, and today we're going to talk all about IVF. So we're going to break it down. IVF you can think of as three parts. One, the IVF stimulation to grow the eggs. Two, the egg retrieval and then what happens in the lab. And then three, the embryo transfer. Today we're going to focus on step one and give you all the information you need to make this process not feel overwhelming, but rather to arm you with all the information so you can take advantage of this successful advanced therapy. All right, so the IVF stimulation, basically what we're doing here is trying to grow your whole batch of eggs in a couple of weeks. And what this means is that you have a cohort of eggs every month. Typically you would ovulate just one of those and lose the rest of the eggs. And this is because we're humans and we tend to have one baby at a time. The other eggs are not lost because they're bad, simply they just are not needed. Fertility is inefficient in a number of ways, and this is one of them. So what we're going to do is take advantage of the fact that you have a whole batch that you wouldn't otherwise use, and we're going to give you little medicines that mimic the hormones your brain makes. You will give these actually to yourself in the form of injections. Typically in the belly, they're small little needles. The nurses will train you how to do them. Totally doable. And these are going to grow your whole batch of eggs. So what we need to know from the start is what your batch size is. And we call this a cohort. And sometimes you'll hear the word antral follicle count, or AFC. And your antral follicle count is basically your resting follicle count that we see on ultrasound when your ovaries are not stimulated. So your count might be 5, 10, 15, 20, whatever it is. We're trying to maximize your potential and get that many eggs to grow. So we're going to titrate your particular dosing of the gonadotropins to your baseline numbers and grow your whole batch. So what happens during the 10 to 14 days that you're taking these injectable medications? What happens is you're going to come in for ultrasounds on day 6, 8, 10, and 12 roughly. So that we can see the follicles growing. We're looking for 3 things. One, we're looking to make sure that indeed your whole group is growing and not just a couple are leading the way, leaving the rest behind. Sometimes when that happens, we do cancel a cycle, regroup, reset, maybe tweak your protocol so that we can optimize your stimulation. The second thing we're looking for is to see if we need to increase or decrease your dosing, just again to maximize that whole cohort. And then the third thing we're looking for is to see when those follicles are ready, when the eggs are ready, because that's when you'll take your final trigger shot, and then 2 days later will be your egg retrieval. This is timed 36 hours later. So that's the basics of the stimulation, and really you can just think of it as a build on if you've done a basic fertility treatment cycle in the past, such as Clomid with ultrasound monitoring and an IUI, it's the same concept. We're checking in with ultrasound to see how the eggs are growing in response to the medicine, and then triggering their release when they're ready, and then taking them out at the egg retrieval at the right time. So that's part 1, and hopefully it's demystified for you, and be ready soon. We'll go over part 2 and part 3. Hope you enjoy the day.